There is a new front in the battle over obesity in this country tonight, a growing problem that cannot be ignored. Here's why. With 2/3 of Americans now officially listed as either overweight or obese, and related health care costs soaring now to $168 billion a year. Now, one of the nation's big employers, the CVS drugstore chain, is taking a hard line on monitoring its own employees' weight, and it's causing an uproar, including a big reaction when we posted it on our Facebook page just today. The story tonight from NBC's Stephanie Gosk.
Numbers on the scales don't lie. This country needs to lose some weight. But how involved should employers get in the process? A new employee health policy at CVS, the Rhode Island-based pharmacy company, has triggered some lively debate and more than a little anger.
I don't necessarily think that that's something they should ask their employees. I just think the cost is just ridiculous.
To take part in the company-sponsored health insurance, CVS employees are now required to have their weight, body fat, and glucose levels screened by their doctors. If they do not, their premiums may go up $600 a year. That's $50 a month. In a statement, CVS says the data collected never leaves the doctor's office and that the goal is to help employees improve their health and manage health-associated costs. Right idea, say some, but the wrong approach.
They may well want a healthier workforce, but they're going about this in a destructive way that really offends people and violates their privacy.
In a 2009 survey of 500 companies, 8% use financial penalties to motivate healthy behavior. Last year, that number jumped to 20%.
Employers use two different strategies to encourage participation. Some, like CVS, use what might be considered the stick approach, threatening penalties, while others use more carrot-like incentives.
At this small insurance firm in New York, the carrot is money. About a quarter of the work staff signed up for a weight loss competition with 17 other companies. Over the course of 3 months, whoever loses the most in their office will get $3,000. Whoever loses the most overall gets $10,000. The contest is purely voluntary.
We have a lot of people that opted not to participate in it this way because they didn't want any kind of information about them or their health out there.
But as employers' health care costs rise, more companies may not be willing to give employees the choice to opt out of wellness. Stephanie Gosk, NBC News, New York.